OK，大家好，我是王育恺。今天我们有幸邀请到Lucas，他是来自 UC Davis 的resident，已经 finish 他基本上已经完成他的那个 resident 的一个 program。他来6月进行一个我们创伤骨科的一个交流。So I'm introducing you, Lucas, to our audiences. Say hello to everyone. So Lucas, I know you're from UC Davis. You are very. I know you're attending Dr. Mark Lee. He speaks very highly of you. He said I just quote him from. He said you are the best president he has ever met. So it's very highly praised of you. Yes, it's just showing that how good you are at the clinics, how good you are at the surgery, and how good you are maybe at the paper or research work. So I just know you just start your kind of orthopedic training from sports medicine or arthroscopy team, right?
Yes.
Initially.
Yes.
And then you changed to trauma surgery or trauma team, right?
For a specialty?
For specialty, yes.
No, my initial goal to go to orthopedics and medical school was to do sports medicine.
So your initial goal is to be a arthroscopy doctor?
Yes.
Okay.
Yes.
So can you tell us why you changed from sports medicine to trauma, why do you choose sports medicine initially?
So I chose sports medicine initially because I played sports my whole life.
Yeah.
Of course. I played rugby for about 20 years.
Rugby?
Rugby.
Okay, since you were young, like 8 or
yeah.
primary school.
Yeah.
Okay.
And so I knew I wanted to go into medicine, and I knew I wanted to do surgery. And so I just had to figure out what kind of surgery I wanted to do. What I didn't know initially at that time was all of the options that were available to me. So I think it's also very similar to saying you want to be a doctor, but you don't know what kind of doctor you want to be. That's because you can't really figure out what's out there until you get there and you experience it. So it wasn't until I started residency that I could experience everything, all of the specialties, and find something that I really like.
Okay. So you've been here for 3 weeks. You know, Shanghai Six People's Hospital is also very famous for orthopedic surgeries. So how do you compare kind of the surgical levels or any kind of our theories about treatment of trauma or orthopedic care? How do you compare? Just to be frank, okay, to be honest.
Sure. So I came here to experience something new.
Yeah.
And it's nice because the system is very different here. The number of surgeries, first of all, is a lot higher. The turnaround time is very fast, so surgery happens very quickly. We spend a lot more time on each surgery, but it doesn't necessarily mean the surgery is better. We just spend time in other areas, maybe in between surgeries, and so the pace is very rapid here, which is different. But I have also realized that trauma is, in essence, a language that's spoken among all people. So the goal is always the same, and even though the treatment's different, maybe different implants or different reduction techniques or different surgical procedures, that the outcome is the same, and for the most part that's achieved very well here, I think, from what I've seen, and so it's a nice contrast.
Okay, thank you for your kind of comments. And you've been following Professor Law for kind of several times in the clinic. So he's kind of mentioning about his series about Chinese medicine, how to rehab. So I think it's totally different from what the North American will do to tell people how to rehab. I know you have a very strong team about how to do physical training after the injuries. But when you learn something from Professor Law, how do you comment on his theory or Chinese medicine about the rehab stuff?
I think it's a very nice alternative to the traditional methods that we use. The contrast that I see when I compare it to Western medicine or the American culture is the mentality of the people, the patients themselves. You know, it takes a certain level of trust and faith in your surgeon to be able to do the treatments that he prescribes. And as you were saying with Professor Low, patients believe what he believes and they're willing to try. And I would love to see that grow in America, but I think it'd be very difficult right now.
Do you think it's back to the origin? Back to what patients and doctors both believe? Because our Chinese patients and Chinese doctors both they have culture, the same culture, so they can accept the theories more easily. But when we want to put the theory into USA patients, it can be a little bit difficult because they don't have the same cultural background. That's what he said, right?
Right.
Yes. Okay. Okay. Let's take a break.
How about that?
So Lucas, next, a lot of medical students in China are always kind of envy or maybe just admire what kind of American medical education systems works, because there is a kind of comparison between we can separate kind of the stages of the doctor's learning. Initial stage, like 4 years in learning basic series, are kind of series stage, and then it moves to the residency stage, and then moves to kind of the attending stage. And when USA and China's medical students were in the kind of theory stage, they are almost parallel, or almost on the same level. They learn series. Even Chinese students are better. But when it goes to the residence stage, the doctors in USA just rises sharply, different from Chinese doctors. If even they entered into the resident stage, they can just grow up, their levels grow up, or their abilities grow up just slowly. It's different, totally different. So, could you just simply introduce what kind of education programs or just forced by the education systems in the resident stage and in basic series stage? Would you just introduce what you kind of learn these years?
Sure. So when you make the decision to go to medical school, usually when you're in college, getting an undergraduate degree. So that's after high school. And you have to make the conscious decision to set yourself up for entrance into medical school. And it becomes more and more difficult this time. Depending on which university you go to, you may have more resources for what's called a pre-med major or a pre-medical track. But for the most part, people will choose a science major to get ready to enter medical school. What's happening more now, which is more common, is medical schools will like to diversify the character of the incoming doctors. And in America, medical professionals sometimes get criticized for not being compassionate or having enough skills to talk and deal with people, which is very important because the patient is the most important thing to your job and your profession. So some of the medical schools now have been changing their focus where you still have to score very well on your exams, but they like to see other non-traditional qualities like majors in non-science specialties. So maybe sociology or history or art or things like that, where it shows that you have developed another side of your character, another aspect of your personality that will help you succeed as a doctor.
So whole abilities developed through your undergraduate stage.
Right.
Okay. There's what I know, and it's from education, kind of the core of the medical education. It's from Canadian theory, maybe. Yeah, if you want to be a medical expert, you have to develop multi-skills like communicator, like a lecturer, and also a researcher, and also a medical practitioner. Is it the same in USA?
It is very much the same, starting from the beginning level all the way to the end. So for example, if you're going to apply to enter medical school, you would have to have several components to look competitive or for your application to stand out. You would have to have very good grades, good test scores, exam scores, which are the basic. But they would like to see an aspect of research. And it's not the same level as when you're a resident or an attending. You don't have to have a publication, but you have to have some contribution to the research aspect. And then another big component is community service. And that just shows your willingness to help people and go outside of your comfort zone. Those are the main things which people look for a competitive applicant.
Mm-hmm.
And then when you move up, it's the same types of things, just on a different level.
Okay. So can you next go to the resident stage? So the major kind of gap between Chinese and USA doctors starts from residency, according to some researchers. So what do you think? What's the most kind of useful, or just what really impressed you during the residency programs? What kind of education, or what kind of the system just helps you to develop so fast? I know you are a member inside the stage, inside the system. You don't know how to kind of tell the difference, but can you just introduce what kind of how the rotation program is, how is the education or forced educations are? Can you just
Sure. I think the first most important factor is picking the right residency for you.
Mm-hmm.
In America, you can pick any specialty you want, but it's the same as getting ready to go to medical school, especially if you want to do something very competitive, like orthopedics. You have to decide that early in medical school, maybe your first year, your second year, because you need time to get ready to apply for that. And then you have to do well on the exam, and you have to have everything like your research and your letters of recommendation from people to support you. Once you get into residency, there can be several factors which can affect how well you rise to the top or how well you end up doing. One is the program that you go to.
Mm-hmm.
So besides some programs are more competitive than others, there's different kinds of programs. There are programs in community hospitals
Mm-hmm.
and then academic centers, and they all have very different structures. It doesn't mean that one is better or worse, but it does mean that there's one that's the right fit for you. So it's very important to find the right fit. And as medical students, we go to each program we're interested in, and we spend a little bit of time there, about 1 month before, to see if we fit, to see if we get along with the professors and the residents, and to see if we can handle the schedule and the courses and the workload of the rotations. Otherwise, you'll never be successful.
Okay, so what you meant is you set the goal early stage, and then you prepare for the goal, and then when you enter the resident stage, you get in touch with the programs and see if you fit, and choose the right program just fit for you.
Mm-hmm.
Right? Okay, and the working loads here about residency or just attendings here are very, like you said, turnaround rates is very high. So how do you compare the working loads in your hospital?
I think the workload for a resident is very high, especially a resident in orthopedics. Some people will choose a specialty based on the lifestyle or the amount of work, and that's because some specialties are less demanding than others. Orthopedics is pretty demanding, but at the same time, which relates to the success level as you asked about, and kind of excelling in residency. Residency is the first time in the process of becoming a doctor when there's no longer due dates for anything in life,
Mm-hmm.
except for the last day when you take your exam after 5 years. But up until that, there's no quiz, there's no test, there's no homework, which I think many students are used to having for their whole life. Before that, there was always something to do. And residency is the time when there's still things to do, but no one's telling you to do it.
No one's whipping you again.
Yes, so it becomes a separation of the people who are willing to do it on their own and kind of rise up, and the people who don't really figure it out and have a hard time with it. So that's one of the things that helps to separate people, because for the most part, if you realize that you're not doing well, you're not excelling, you have time to fix it. And so I think that's why usually people are pretty successful in residency, because you have to start to take the initiative on your own.
So self-motivation about any stuff after you finish your kind of learning, being a kind of role as a student and
Yes.
to real doctors.
So my wife is a veterinarian, and it's the same. So if you bring your dog in and your dog needs surgery, I tell you, well, surgery will cost $5,000, and then people will say, well, you're only saying my dog needs surgery because you want to make money.
Yeah, that's what the condition here. You know, they think the doctors want to make money from the prices, but actually not. Actually, not that same stuff. So does the vets get insurance? Their pets? Can American people get their pets under insurance?
Yeah, but it's not so common.
It's not so common. Okay.
Yeah.
It should be common because I think every American family, like, equally they have pets, one or two.
But people think differently
About the dog and themselves.
about the pet. Yeah, like some people will spend their life savings to save their dog.
Yeah.
Some people say if their dog is sick, then just put him to sleep and we'll get a new dog.
Okay. Different theories.
Yeah.
It's not always, they consider pets as their friends. It should be.
Mm-hmm.
If it's friends, they should kill them. It should be actually, but
Yeah, but terminal illness in animals is very common.
yeah.
It just is treated differently. You know, humans, you try and save them for as long as possible. Animals,
Yeah, the life expectancy between animals and human are different, yes. So, okay. Yeah, a lot of people here, white collar people, would choose Starbucks for cafe. It's a choice. What do you think? You know, I know you're a caffeine addicted a little bit.
yes.
So, what will you choose at home? Will you choose Starbucks or any other stuff?
I would choose anything but Starbucks at home.
Yeah.
Yes.
So, any reason? Because the coffee beans?
No, only my personal taste. I think Starbucks coffee tastes like water.
Really?
Yeah, it's
It's
very
not strong enough?
very weak and sometimes a little bitter. Yeah,
A little bitter, okay.
a little bitter.
So how you justify the coffee is good? You can, after you take one shot, it didn't make you more alert. You think it sucks, right?
No, that's if you wake up when you drink coffee is added plus, but it's more important to have nice flavor.
Okay.
So
you don't like Starbucks? Yes.
Yeah.
Okay. The Starbucks is very costly in USA. I don't think so.
It's equal with other coffee. Yeah.
When changed to Chinese money, it's equal. I think. As
Yeah.
well.
How to order? How to order Starbucks?
How to order? Yes. Another question is how do you order Starbucks? If you go to the Starbucks shop, large, medium, or small, or whether grand tour or any stuff.
I think to keep everyone happy, you just point.
Okay.
Yeah.
Simple and clear.
Yeah,
right?
yes.
Okay.
How about that?
I think that answers a lot of what people concern. Like just I just mentioned to you the popular video on about Beijing people order Starbucks. And back to a very sensitive topic about salary. You know, during our residence stage in Chinese big hospitals, even residency is not. I don't think it's not very kind of well paid. You know, and just asking for salary directly is difficult for you to compare. Just let me assume that if you work how many years do you have to work as a residency to buy an apartment in UC Davis, near the UC Davis?
So I think it depends on where you're at in life. In America, you can buy a house with what's called a first-time homeowner's loan, where you don't need a down payment, and depending on where you live, you can afford a house payment every month on a resident's salary.
Even on a residency salary, you can afford a house.
You
Okay.
can. So while you're in residency, living is manageable, but you have to
work hard.
but you have to be conservative. So you can't take a lot of vacations. If you have a family, it's very difficult. If you're single, it's much easier.
So I know you love your wife. So how you manage your kind of home life with your kind of residency work Is it manageable because the time is always spent in the hospital?
It's very difficult.
Does your wife complain?
Yes.
So
Yeah.
how just buy gifts for?
No. I think you have to be able to separate work and home.
Yeah.
And one of the best ways to do that is to get a routine that works for you. So a lot of people will try to study before work, which means to wake up early, maybe 4 or 5 in the morning, and do 2 hours of studying or research or papers, and then go to work. And then after work, you can come home and the time is free for your family.
So taking these people as example, when do they sleep? They get up at 4 or 5. 10 o'clock? I don't know.
Oh, what time? Yeah, maybe 10, 11. It depends. I think for the most part, most of us in residency during this period of life are a little sleep deprived.
Sleep deprived. Okay.
Yeah.
So how many hours a week do you work as in orthopedic residency?
I will work at least 80 a week.
80 hours a week.
Yeah.
Do you on call sometimes?
We do have call schedule. When you're a junior resident, you sleep in the hospital. And when you're a senior resident, you are on call about twice a week for any emergencies. Yeah.
So how many years in junior and how many is senior residency?
Residency is 5 years.
Yeah, totally.
And the first 3 years, we consider you a junior resident. And then 4 and 5, you're a upper level resident.
Any test you have to pass to enter another stage, enter the senior stage?
No tests in between. We have one yearly examination, which is a assessment of your knowledge. But you get a score and then you work to improve it, or if you're doing well, then you keep going.
Okay.
But it's nothing that keeps you from progressing.
Okay, another kind of topic people are interested is about the Obamacare or the insurance policy in the United States. You know, like what you've observed in our country, that people come and go freely to go to hospitals for ask for help. You know, but I know just in America it's a little bit different. You have to find it's just a kind of not a major sickness. You have to go to the family doctor first and
Yes.
get a reference to a kind of, if they cannot handle it, get a reference to a kind of bigger hospitals for help, like a specialist. And what's the real question is, how does the Obamacare work? Because he's trying to kind of promote, to improve the insurance policy in the United States. Does it work?
So Obamacare does work in a sense. Some of the criticism of Obamacare are, of course, from people who have been paying members of their insurance plans for many years and who are taxpayers who now pay some money to provide health care for people who are unemployed or unable to buy health care for themselves. So there are some people who do not agree with that, but the purpose behind Obamacare is to create a society where everybody has equal rights to health care regardless of socioeconomic status. And the difference with that is we have so many different healthcare plans that if you have more resources, more money, maybe you want to pay money for what you think is a better healthcare. And so in that case, you will have your own insurance. And so that exists as well.
So does, according to kind of your experience or learning, does the poor people get benefits from Obamacare in reality? Do those people buy the insurance themselves or get kind of any help from the insurance?
They do, but it's one of those things, the saying people have to want to help themselves to get help is kind of holds true. So everything is there for everyone to have health insurance, even those who can't afford it for free. But if you don't go and sign up for it, then we can't help you. So you have to at least have the initiative to go and get it.
Okay. And you know, when we in China, when doctors want to tell you about you have to take a medical treatment, or you have to take a surgery they want to inform, when they inform the patients or patient's family, they have to inform the prices of the treatment or the surgery as well. Do you do the same job, or just let the insurance company do it?
No, we let the insurance company do that. Yep, and it's usually never a factor of how much does it cost out of your pocket. It's how much the insurance company will get paid from the hospital. So.
And so, what's your incentive to choose a kind of a public hospital at first? But as a residency, you have to rotate in a public hospital according to a program. So, would you decide to choose a private hospital later after you become attending, or you just want to be a kind of attending in the public hospitals?
So you mean an academic versus
Yeah, the salary, the income.
Sure. So there are a lot of factors to consider. I think the most important is what your career goals are.
Mm-hmm.
So if you want to continue to do research, you should be in the academic center. For me, I want to be in the academic center for several reasons. One, I want to do research because I like what I do, and I want to discover new things. And then the second, which is also very important to me, is to work with residents. I like to teach, and I like to try and inspire people to find what they like the same way people have done that for me, and help me to get where I am. So those are the two things for me. Of course, there's always the issue of salary. And it's not so simple to say one place pays you more than another place, because with money comes other things. And it's not necessarily more work. It can be things like the quality of work, the other things that you have to do, like paperwork. For me, the most important thing for me is learning, surgery, research, teaching. Everything else is extra.
Okay.
So if I get paid less, but I don't have to do that extra stuff, that's okay, because I'm happy. For some people, they don't have those kind of priorities. Maybe it's okay to do the same surgery every day, the same way, and leave at a very nice time in the afternoon every day and get paid more money. But for me, I would not be happy.
Okay.
So everyone has the right place for them.
Yeah. So life goal is different.
Yes. Yeah.
So you have a happy job for you.
Yeah.
Okay, that's good. And the final little topic is about the election, the president election carrying on in the United States. Hillary and Trump are right now is going to fight each other at the final stage. So what's your opinion about Donald Trump? Because a lot of kind of elites were saying that he's just a kind of joke, or he's not the right person they want. But a lot of kind of from lower levels, or maybe lower levels people may think Donald Trump represents for them, because he's speaking, or he's saying that what they really think, or what they deepest heart saying. So what's your opinion about this kind of election, and what's your opinion about Donald Trump?
Yeah, how about that?
Yeah, how about
How about that? Well, I'm actually Canadian.
Yeah.
So
it's none of your business.
Right. So I will not vote.
Yeah.
But in my opinion, I think that you never really know what's going to happen until after it's happened. So there's a very short period of time where we listen to Donald Trump and Hillary Clinton, and we hear what they say, and we do our best to decide who we believe, and then we have to wait and see. So I think that historically Donald Trump has never been someone that people thought would become the president, because of what he's done in the past and his career to this point. But I don't think that means that he can't be a good president. He just goes about things very differently. And of course, Hillary would be the first female president in the history of America, which would be a nice milestone for the country. But again, I think no one can know for sure what will happen. So I will not vote, and I will
wait and see.
Hope for the best.
Okay. Both of them, either of them be the president will open a new page for the United States history about president. Yeah, that's
Yes.
good. We are kind of we are also waiting to see the results. Yeah. Okay. Thank you.
Okay.
Thank you. Thank you for your help.